Hi, this is Dr. Michelle Ellern. I'm a cosmetic physician here at Reflections, and today we are talking about cellulite. So many people have cellulite, and it is a very, very common complaint that we see here at Reflections. It is most commonly seen in women, but it is also seen in men. It can be contributed to by having thinner skin, aging. You start noticing it in your 20s or 30s, especially in women as the estrogen continues to decline, it continues to worsen. So many people are trying to find a way to lessen the appearance of it. So we're going to go through some different options of treatments and figure out what would be right for you based on the type of cellulite that you have. So many people don't realize that cellulite comes in grades. So cellulite can be 0, which is like a supermodel who has 0 cellulite, and we're not going to talk about those people. Type 1 would be if you actually pinch your skin in order to see that septi. So you actually have to grab the skin and pinch it together, and those are the people who are complaining about cellulite who don't really have much of it to start with. 2 is when you have cellulite when you stand up, and that's probably the majority of, I would say, like 30-year-old women. When you see it on the back of your thighs, right on your buttocks, you'll see that like rippling effect. And type 3 is when you have it both lying or standing, and it doesn't matter, and it's just there. Those are the types of cellulites that we are treating with these sorts of treatments and devices. So in terms of what was used in the past, the reason why we've kind of tried to move beyond what was in the past is that they had many downfalls. Some of them were painful, they didn't last. They could even create worsening of cellulite if not done correctly. Or they could have limitations of needing to do it as more of a surgical procedure with a lot of downtime that just wasn't feasible for many people to do. So in terms of what is available and what new updates there's a couple different treatments that we utilize here at Reflections. The first treatment option is Profound. Profound is a newer treatment option available. It is a radiofrequency needling device. So what it does is it has silicone insulated needles. Those needles will go at a particular depth, which is fairly deep into the skin, to create injury to the fat cells. That injury will help break up the fat cells, similar in concept to like liposuction. Those fat cells will be killed and they will be cleared out of your body. By eliminating these fat cells that are protruding more superficially, it will lessen the appearance of cellulite. The treatment itself is fairly easy to get through. We numb with injection of lidocaine. We use these needles over the area. It's very comfortable. And then that fat will be cleared over your body over the course of about 3 months. So it's a really great treatment, especially if you're a grade 2 or 3, you can see a fair improvement in your cellulite appearance. The next treatment we can address is injectables. So there's injectables such as Sculptra or Radiesse that can be used, injected under the skin for collagen building. It can be used to help break up some of those septi and also help thicken the skin up, so you're getting a little more elasticity, and that can help eliminate that appearance of cellulite through your skin. Again, treatment time depends on the amount of area we're covering, and the results usually take around 2 to 3 months for that as well. Same concept, we're trying to build up some collagen of your skin, and that takes time. So we're doing these generally as a series. You can do them usually 3 times in a row to help kind of build up the skin. But treatments are all customized based on what your cellulite looks like and what your needs are. So there's no cut and dry cookie cutter approach to any of this. The third treatment option is Excellis. So Excellis is also a radiofrequency device, but it is applied over the surface of the skin. It's actually been updated in the recent years to include ultrasound. That can push the heat a little further in and be a little bit more effective, and it's really a wonderful treatment. Very comfortable, no downtime whatsoever. You come in, you do the treatment, it feels like a hot stone massage. Very comfortable and easy to get through. It is good for more of a type 1 to 2 cellulite where you have just that little rippliness that we're trying to get a little collagen building and try to eliminate that appearance that you may not have had when you were a little bit younger. Cellulite doesn't necessarily have anything to do with how much you weigh. There can be very, very thin people who have cellulite, and we'll see a lot of people who care a lot about their bodies. They work out all the time, they're doing other treatments here, who have that little rippliness at the back of their thighs, and they can be quite thin. And they just don't like it because they're going to the gym every day and they're working hard on their body to be perfect, and that's one thing they can't fix by diet or exercise. So what they do is these sorts of treatments to just eliminate that little irregularity that they feel is detracting away from their appearance. So if you feel like you're bothered by cellulite and that this issue is something you would like to deal with, we ask you to come in for a free consultation. We can evaluate what type of cellulite you have and come up with a treatment plan that works for you. So if you have found this video helpful, please give it a like, and if you would like to see more videos like this, please subscribe to our channel.